Hey guys, it's Lauren. We are going to talk about some stepping strategies that you can do if your kiddo has difficulty with ambulation. So if your kiddo is, maybe they're more significantly impacted, they have developmental delay, and they struggle with walking and typically need someone fairly close by when they're walking, this video is for you. Stay tuned. So for this video, essentially, I'm just gonna really walk you guys through what I would do and just different strategies that a kiddo needs in order to be able to walk and to transition in different areas. So there's a couple of adaptive equipment that is really helpful that I'll post down in the description below, things that we use in the school district that have been really helpful as far as gait belts with handles, drop harnesses, things like that that you can use to assist your kiddo if they need help with walking. It's like a gait belt, but it has a little bit more oomph to it so that it gives you some handles so that you can actually help guide them in certain directions. It can also be utilized for older individuals if you are in a caregiving capacity as well. So the biggest thing when you are assisting somebody with walking is essentially you want to make sure that they are able to walk in a bunch of different directions. So not just forward, you want to make sure that they're able to take steps backwards, to take steps to the side, to try to be able to rotate, so take steps in a circle, whether it's a full 180 degrees or 90 degrees. Basically, if you're standing forward and you need to step to the side to sit in a chair, things like that. So because there's just me today on the video, I don't really have another person, so it gets a little bit tough. But basically what I really just want to reiterate is working on different directions when you're working with a kiddo to encourage them to walk backwards, to take steps backwards, to take steps to the side, and to turn their body in different areas. So essentially, if you have someone in front of you and they are not visually impaired, if they are visually impaired from working with some vision specialists in the district and orientation and mobility specialists in the district, they typically instruct us to be in front of them or to the side of them to give them a little bit more comfort and understanding of where they are in space, to mostly guide them forward versus being behind and the person with the visual impairment in front. But if your child does not have a visual impairment, typically if we're walking with someone and they're exploring their world in front, we're assisting from the back, and you would have a gait belt, or you would have a gait belt with handles or a drop harness. You would essentially hold the gait belt and guide them. So if they're in front of you and you want to help them take some steps backwards, you're going to give a slight posterior or backwards direction, and you'll have kind of a staggered stance. So your feet are separate so that if they were to fall backwards, so if they were to go like this, instead of taking a step backwards, you would be here and be able to hold their body weight. But typically what we would do is we would just give some general cues, tactile cues, so touch cues to the leg if we wanted to have them take a step backwards. Using visual pictures like walking backwards or sitting down if your kiddo is nonverbal or limited verbal, having them practice taking steps backwards so that they can feel the chair behind them, or having a hand over hand to place it on the armrest so that they know to take a step backwards and to bring their body down. Those strategies can be helpful for kiddos to learn that process of transitioning their body. You can also have them try to take a step back and put their foot on like a noise-making material, whether it's a switch or a button on the floor and just have them kind of take a step back with a pointed foot to see if they can make a noise. Any kind of extension will help work on that as well. Again, if you're going to transition, you're working with a kiddo on a specific motion, something that is functional, you are going to assist them. You'll be behind them, kind of holding onto the skate belt, having a small picture card if they're nonverbal, saying it's, you know, it's time to sit, and then having them move the leg that's closest first. So giving them some tactile cues here, or kind of encouraging them to put their hand here, feel like this, we're gonna sit, time to sit, and then trying to help guide their body into sitting down. So again, this is more, instead of taking steps backwards, this is more taking steps to the side. Typically it would look something like this, and then you would give some backwards guidance. If you're on the front, you can also give some guidance at the hips. If I push backwards on the hips, my hips bend, my butt goes backwards, and I sit down. You can also give them cues behind the knees to try and get, say, bend your knees, try and get them to bend their knees in order to sit, depending on how tall the kiddo is and where you're supporting them. If they're in front and there's the blocks here, you can only go backwards, encouraging them to go backwards by giving them some gentle encouragement on the back. So you're gonna hold the gait belt and give a backwards gentle pull. Again, it's more of a guidance. It's not, you're not yanking anything. It's just a gentle 10% pull in order to guide them backwards and kind of giving them some tactile cues on the back of their leg so that they can take a step back. If this chair had a hand support, I would guide their hand backwards so that they could reach for the chair. Okay, I know it's time to sit down, along with pictures or sign language, time to sit. Sit is a really good one, 2 fingers, and then you kind of curl your fingers around. So time, like you're wearing a watch, time to sit can be really helpful for kiddos as well. I hope you find this helpful. If you have any questions or other topics you would like more information on, put those in the comments below. I love making content specifically for you guys, especially things that you're curious about learning. Talk to you soon. Bye.